I'm sure we've got an online audience that has been waiting for us, so we need to start. Okay. So this afternoon session, as you read, is called Valuing Evidence in EIDM Differently: Equity, Inclusion, and Trust. Yesterday, we started talking around these issues, and I raised some questions. We talked about how it is important to bring the different groups of people together. And the reason is that people have different ways of seeing any situation or interpreting. And it is important that when we bring different views, we also have a comprehensive understanding or analysis of evidence. And it must come in all forms of languages, all forms of communication besides what you and I know, or the people in this room know. So it is important to just look at what are the lived experiences, that how are people practicing this. We've got 3 distinguished panelists that are with me here that will speak to some of the work that they're doing in the evidence space. And I would like to introduce these panelists, and they will each take a turn to just give us how they are really valuing evidence differently, looking at equity, inclusion, and trust. On my far right, we have Andile Madonsela. She's a highly motivated individual who is driven by the idea of social justice. She currently works as a managing researcher and gender and evidence lead at South African Center for Evidence, NPC. I will not read her bio in full because I know you all got the opportunity to do so. I also want to introduce I will start by introducing on my near right, Evelyn Jepkemei. She's a senior education officer with education.org. And she works closely with the chair for education, science, and policy, and the managing director of helping in building early impact and accelerate progress by driving development of best-in-class technical leadership to organizations, partners, and collaborators. On my left, we have Nain Mirabel. She's project manager with Effective Basic Services Africa, eBase. She's an award-winning evidence leader and a world pulse change maker, passionate about evidence-informed decision-making and inclusion of people living with disability in the evidence-based practice. And so here are my panelists. They'll each have an opportunity to speak, and then we'll have question and answer. I really believe what enriches the conversation is when we can weigh in. So please jot down your questions. We'll have all the panelists present, and then we will then come to you for questions and answer. And in fact, even examples that you may give around equity, inclusion, and trust. Andile, over to you.
Thank you so much for that very nice intro. Can I please have my slides? Thank you so much. So just as I have been introduced, hi everyone. My name is Andile Madonsela and I work as a gender and evidence lead at the South Africa Center for Evidence. And I'd like to tell you more about the Evidence Transformation Index that we have been working on, myself and Lawrence Mahlanzalanga. Let's see if this works. Oh, great. So basically, I'd like us to just go back to sort of some of the bakings around EIDM, right? So if we are all on the same page that the reason why we are even in this space is because we want to use evidence to implement more effective policies and interventions that are able to fight against poverty and inequality, right? But then the basis of that is that we are using the best available evidence. But then if these interventions and policies are aimed at the most marginalized people in our societies, it becomes important then that the EIDM process and everything that is also surrounding EIDM is also sort of sensitive to the needs of those who are marginalized in our societies. So I think there are 3 areas in which the EIDM process has to be sort of sensitive to gender, equity, and trust as well. So we have identified those 3 areas as firstly, the methods that are followed. So if we're looking at evidence, the methods that were followed, are they sensitive to gender, equity, and inclusion? But not only the methods, but also the evidence translation process as well has to be sensitive to gender, equity, and inclusion as well. But not only that, but also the decision-making process. So it's therefore important that we don't miss it at any point, right? Because if we are sensitive as far as methods are concerned, then we lose it maybe in the translation of the evidence, then we lose the whole focus. So it's very important that at all 3 levels, we continue to maintain that not only are policies and legislations and interventions evidence-informed, but to ensure that they are considerate of the needs that are of those who are most marginalized in our societies. So I think then we have been quite active in trying to find out how best we can assess the extent to which the evidence that we use to make recommendations and to create evidence maps and systematic reviews are sensitive to gender, equity, and trust. And then, so maybe the first one there is that we have used the 3IE equity coding tool to assess the extent to which the evidence that we use is sensitive to gender, equity, and inclusion. And then over the years, we have also incorporated a certain element, which is what we call the JESI. And the reason why we have it is because we produce a lot of evidence maps, right? If you don't know an evidence map, please come to the Incubator Hub. You'll see what an evidence map looks like. But an evidence map gives you a nice overview of the evidence base that you have, right? So I think we thought that it would be great when you open an evidence map, it does not only just tell you the quality of the evidence in that evidence map, but also the extent to which the evidence that you're looking at is sensitive to gender, equity, and inclusion. So I think we developed the JESI tool, which has tells us the extent to which the evidence is sensitive, considerate, or absent, right? So we rated studies as JESI sensitive if they looked at vulnerable communities or people. So if a study was focused on disabled people or displaced people or migrants, or people living with HIV, for example, that study would be coded as JESI sensitive, right? We would consider it as JESI sensitive. But then a study was coded as JESI considered if it actually, so as much as it maybe sampled maybe both men and women, people with disabilities and people without disabilities, in their analysis or in their methods, they were cognizant of that. So they were like, okay, this is the intervention that was done, and this is how the impact of the intervention on women versus the impact of the intervention on men. So as much as they did not only sample populations that are marginalized, they were quite aware to understand that chances are the impact on different populations would be different, right? And then studies were rated as JESI absent if they did not consider that. So if they just report on the impact, or everyone really loved this intervention and it was great, or oh no, this intervention was not really great, but it does not take into account the difference as far as populations are concerned. Right, so, but then if we have done these two, why then do we have this evidence transformation tool that I'm telling you about today? So the reason why we wanted to develop this tool is because we wanted a tool that really aligns with SA government's definition of what equity is or transformation is. So we wanted, because we work very closely with our national departments, so we wanted a tool that speaks to them. So when we say equity, we don't use our own standards or the standards that we are adopting from other studies, but we are using the very same frameworks that they are using on a day-to-day. So that's the reason why we took up the task of developing this specific tool. And we also wanted to apply this tool on policy-relevant evidence maps. If Promise Ndugu was here, he would tell you about sort of the work that we've done as far as policy-relevant evidence maps are concerned. So those are evidence maps that speak to existing policies or policies that would be developed. So we wanted a tool that will work with those. I don't think it's, okay, great. Did I move too much? Okay, so then what is this transformation index I'm speaking to? So it's a document that guides you on how then to assess the extent to which evidence is sensitive to equity, but looking at the definition of equity according to this framework. And what is that framework? So the framework is the broad-based Black economic empowerment. Those of you who are from South Africa, you know this already, but for everyone else, so this is a framework that was developed after we attained democracy. So South Africa was historically under apartheid, and that does mean that there was sort of a hierarchy which placed Black people at the bottom of the hierarchy, and sort of there was a few white people who had the means to participate in the economy of the country, and everyone else was excluded. So to make sure that we balance things out after attaining democracy, the framework was introduced. So the framework then therefore targets Black people, specifically women, youth, people with disabilities, and people that are living in rural / underdeveloped areas. So that's sort of the target of the framework, and that is sort of the very same framework that this tool is based on. Okay, so then when we are actually looking at this evidence, what are we considering? So the first thing is that, does the study sample Black people, right? So it's twofold. It's either you have sampled Black people only, or you sampled all populations, but then you disaggregated the data according to race, right? Or the impact of the intervention according to race. So same thing would apply to women, young people, unemployed people, persons with disability, people living in rural areas and underdeveloped areas, and then military veterans as well. Just to reiterate that the populations here, we got them from the framework. So we did not come up with these sort of target populations, but we got it from the framework itself, right? And then it also does give us a definition of what a Black person is, what a woman is, what a young person is. And then what then happens is that we scale that study, right, from 1 to 100. So we would look at, does it have Black people, does it have women, young people, unemployed people, and then there's like an overall score, right? So if you look at the far right, you can see that if a study sort of gets 0 to 19 points, then it's coded as transformation absent. And then if it's coded as, so if it's between 20 and 39, then it's transformation critical. And then 40 to 59 is transformation moderate. 60 to 79, transformation sensitive, and 80 to 100 is transformation focused. So I think there's also an important thing to note here at the bottom that a piece of evidence gets extra points for adopting equity sensitive research methods. So if they went above sampling and disaggregating the data and looking at the impact of this population versus the other population, then they get extra points for that. And then these overall points would therefore be what you see when you open a policy-relevant evidence map, right? So if a policymaker wants to make a decision, not only do they have sort of all the evidence in one place in the evidence map, but they can also see to what extent that piece of evidence is aligned with the very same framework that they work with every day. Okay, and then, so what's next, right? So the very important thing, important point to make here is that DNA, co-creation is part of our DNA. So we never sit down and develop things and we say, oh, okay, this is the truth and that's it. So we are very much focused on making sure that it's user focused. So our users would be the decision makers that we are targeting. So I think what is next currently is that we are planning to do consultations. We have done a few already. I've done 3 to hear from the decision makers and our national departments what their thoughts on this tool is and if it's applicable to their work, because it has to be relevant to them, because that's the whole point, right? And then we also want to speak to you, so I'm glad I'm here today. If I tell you about this transformation tool, what are your thoughts as well? So I think we are also planning to also consult with others within the evidence ecosystem to hear if I was developing an equity tool that speaks to policy-relevant evidence maps, does this make sense to you, right? And then we also want to pilot this transformation tool. So we're going to try it out on some of the evidence maps that we have produced over the years, and also the ones that we are busy working on, to see sort of how it does in practice. Because sometimes you come up with an idea and it's really great, but when you have to actually apply it, you realize, okay, I think we might have missed some things here. So that is sort of something we want to do also. And then we also want to document lessons, because there's a growing recognition of the importance of assessing the extent to which evidence is sensitive to gender. I know that Laura is doing her PhD and it's linked to this, and she told me that she found quite a lot of tools that are doing similar things, right? So it's very important that we continue then to document lessons that we get from this work, so that if you are then developing your own, you are able to sort of learn from that. So that is also something that we want to get into. But otherwise, yes, that is the evidence transformation tool. Looking forward to getting your thoughts and your comments about this tool. Thank you so much.
Thank you so much, Andile. And I would like to encourage you to just write your questions for Andile down, and then we'll have a discussion at the end. And I think for me, this is quite a very important tool, the Evidence Transformation Index, because it's actually relevant to the South African situation where it's based on BEE framework. So let's go to the next presenter. I will not attempt to summarize because I don't want to take time, and we'll have enough time to speak after our presenters have presented. Over to you, Evelyn.
Thank you very much. My name is Evelyn Jepkemei. I am Senior Education Officer at education.org, and I'm based in Nairobi. Today, I want to talk about democratization of evidence and our experience in looking at evidence in such a way that we want to see the utility of that evidence within the education space. May I have my presentation, please? And the first question that I asked myself when I was asked to speak about democratization of evidence was, why are we talking about democratization of evidence now?
So these are the wrong slides. We need the ones for Evelyn, education.org.
Anyhow, let's proceed. The slides will come later. Part of the reason why we are focusing on democratization of evidence, particularly in education, is because when you talk about education, just like health and like agriculture, it touches every family, okay? And so when we discuss issues around evidence, we are actually discussing issues that are likely to affect each and every family and actually every child. And so the tradition that has been in education is we have a lot of research. We are scholars. We have We have the knowledge, and there is plenty of research across the board. However, there are certain challenges, particularly that are pertinent to that sector, that we have observed, and we're trying to do something about it. One of those is that even though evidence is collected within, say, for example, within Africa, they're usually reported with a lens that is not African, that is not contextual. And so when solutions are then developed as a result of that kind of evidence, we have a challenge, because then those solutions do not fit. They don't create a good fit for the needs of the society. The second thing, of course, has to do with the process of designing, the process of processing that research, and also of using. What we found out is that in education, policymakers do not always go to research journal, peer-reviewed journal sites to be able to access evidence. In Kenya, we work very closely. Our program is embedded within the ministry. So we work with colleagues from the ministry. We sit at the table and we ask ourselves, where do you go to when you are asked to develop a policy brief? And they said, I call the director at the county level, and they tell me, how many children are enrolled, and that is how I do my work. But that evidence is already available somewhere. But the culture is designed in such a way that policy making is not inherently, it does not inherently seek evidence. As educators, we want to use the wisdoms that we have. We believe that we know, and so we make our decisions based on what we believe is correct. The other thing, of course, has to do with how the system is aligned with the efforts that produce evidence. Usually, the permanent secretary for education in Kenya once told me that government does not do research. We only consume. But even that consumption, of course, is an issue. But the fact that government doesn't do research means that responsibility is left to all of us here. Now, how do we link? First of all, how do we generate that evidence within the communities? Are we involving the communities? Do we have their voices? Do we amplify the voices of those communities? And does their opinion make its way into policy? The second level has to do with the evidence producers. There's a lot of research that is done locally by local people within the universities and so on that don't make it to the peer-reviewed journals. But it's good research that we can actually be able, has nuances and insights that can be used in education. So we are looking at all that, and our effort is an effort towards equity and democratization of evidence, which hopefully will then translate into democratization of education. My slide hasn't come, but we'll continue, no problem. So the next point that that I wanted to mention is, what are the challenges? In our reflections, the challenges that we know are prevent the bureaucrats from using evidence. And one of those is that whenever we produce evidence, we package it in a language that is not friendly. It's difficult, it's very complicated. And our reports are usually bulky because there is a format you have to follow, because this is research. You must have the theoretical framework, you must have this and that. And a policymaker who has to go for 3 meetings in a day does not have the time to be able to sit and go through that and decide what are the implications of what I have read. The other thing, of course, has to do with the the ability of policymakers to actually translate the evidence that is available into actionable points for policy and also for practice. And of course, there's the question of the research world prioritizes scientific research, and it prioritizes academic work than, say for example, action research by a teacher in a school and so on. So looking at all those challenges, we feel that because then policy is not necessarily always informed by evidence, and actually by and large it's really not informed by evidence, we feel that whatever references that the policymakers use creates marginalization, okay? Because you haven't had everybody's voice. We haven't had voices from even the marginalized communities and so on. And even if we have, we may not have translated those voices into actionable insights that can actually be able to be used in education. So then, what do we do therefore? At education.org, we are looking at two main pillars to be able to address the question of democratizing evidence. The first one is, as I said, we embed our work within the ministries of education, and so by doing that, we design certain activities that will help us to be able to strengthen the systems. It's not just about training specific people, but strengthening the system and helping to create a culture of evidence use. Because sometimes depending on who the partner is, the ministries of education can actually use evidence for that particular activity. And then for another activity, they don't do that. So what we are trying to do here is to work together and understand their needs and respond to those needs in a way that we are not prescribing, but we are sitting with them and we are supporting them to strengthen those systems. And so that the system strengthening is the first pillar. The other pillar, of course, is to actually make available evidence to policymakers. And how do we do that? I want to use the example of our first product that we did during the time of COVID. At that time, in the example of Kenya, for example, there were questions around how do we recover, how do we help the children, how do we stem the learning loss? And the Ministry of Education had already allowed certain models of accelerated education in the marginalized community, in the arid areas where children are not able to access education in the traditional way, and also within the refugee communities. But then now here we were looking at a challenge that is affecting all children because learning loss was a real issue. And therefore the government was considering accelerated education and said, we have no guidance. We don't know what a good accelerated education program looks like. And so at education.org, what we did is we undertook a synthesis. We sourced for evidence across the board, both published and unpublished, both from practitioners and also from all evidence producers. And we received this huge number of studies and reports from different places. And so what we did is we synthesized that evidence and tried as much as possible to answer the question, so what? So we gleaned the actionable insights that the Ministry of Education, when they look at it, they say, okay, let us sit down and develop the policy that will guide accelerated education. So we disseminated very widely the product of that synthesis work, and we're very proud to say that it formed the basis for the accelerated education policy in Kenya, and now in Sierra Leone. My presentation had a very beautiful diagram that I wanted to show you, but unfortunately it didn't work. But I hope at some point, look for me, I can email that to you so you can be able to look at it. And so our journey then continues. The next step or the next activity that we're trying to do in this space, and from experiences that we have had in trying to synthesize evidence, is that gray literature in education is a very is a very gray area, gray not in a good way. And so what we are trying to do is say, how do we support the evidence community to be able to decide how do you access and how do you identify gray literature in education? How do you access it? How do you categorize it? And how do you appraise it? So that is the work that we are currently doing. I'm not going to talk about it here because in the next presentation in the innovations room, I'm going to be specifically talking about that particular activity. But so here we are, that through synthesizing evidence and making sure that we have evidence available for policymakers, we want to make sure that we are simplifying the language that evidence producers use. We want to make sure that we are speaking the language of policymakers, and we're not giving them bulky work. We are giving them guidance. And by the way, we are not also prescribing to say, this is what works, this is what you ought to do. For Kenya, for example, there's a whole difference in the context that Kenya is and in the context that Sierra Leone is. So even though the synthesis is one, we have adapted what it means for Kenya and what it means for Sierra Leone. So I think up to that point, I want to thank you very much. And I'm so sorry that my presentation was not able to load. Thank you.
Thank you so much, Evelyn. And I think apologies for that, that your presentation was, but you really held it well without the, so it's good to internalize and know your work. So well done for that. So I think one of the things that I'm taking home is around democratization of evidence leads to democratization of education, and the idea about gray literature. And I'm just emphasizing that because I think it's a key issue that maybe if you want to know more, you can follow through to the next session. So our next presenter, Nain, I've already introduced to those who are coming in, but you can look up your apps to know more about Nain, who's from eBase. Over to you.
Good afternoon, everyone. Great. So today, through Ankini's story, I would like to share with you how we can, or we could make millions of young people with disabilities to prosper by valuing evidence differently. My name is Nain, and I am a researcher at eBase Africa. I'm also an Africa evidence leader since 2021 and a World Pulse digital change maker since 2022. Okay. So in my plan, I'm going to show you the impact of our intervention, how we did it differently, and then I'm going to tweak your minds a little bit around questions like, is invited to the table, or is invited to dinner the same thing as invited to the table? And then we're going to walk around equity, inclusion, and trust, and how we are enhancing evidence use through our intervention, and what next. So starting with Ankini, let me tell you a little bit about Ankini. Ankini is a young boy, 8 years old. He has a disability and lives in the neighborhood in Bamenda, Cameroon, where I'm coming from. And when we met Ankini, he had a lot of unmet needs. His health needs were not met. He was not meeting hospital appointments regularly. He was not attending school regularly. He was isolated from the community. He didn't have friends. and his parents were also struggling with him because of his disability, and it looked like it was a burden to the household. And Ankini is just one of the children whom we worked with. We actually worked with 30 children with disability and their households and community. And the impact here is, the focus is on the quality, how we impacted on their health, education, livelihood, empowerment, and social well-being. So since the conference began, we have been talking a lot about policy and practice, but we have talked very little about population. By population here, I mean citizens, households, families, and communities. So in our interventions, we are asking questions like, what tools could work for people with disability? What formats are best for people with disability? What are existing structures that we can leverage on? And this led us to developing an evidence toolkit that brings research into the households of people with disability in consumable formats. This toolkit is called the E-Based Family-Centered Evidence Toolkit for Disability. And we brought this through, we leveraged on community health workers and social workers to explore aspects of disability during their routine household visits so that they can bring research targeting health, education, social well-being, livelihood, and empowerment to the households of people with disability and have them and their families engage in these evidence recommendations to improve on their livelihoods. We looked at evidence databases if the resources on these databases are accessible to people with disability. You see a graph there. We see the blue. The blue stands for access to the website, and the orange stands for access to the resources. So the people with disability have some access to the website, but they have difficulties accessing the resources in the website. This means that we have actually invited the people with disability to dinner, but they are sitting away from the table. And we are eating at the table, right? That's why we titled this paper, Invited to Dinner, but Not to the Table, Web Content Accessibility Evaluation for People with Disability. This research paper has currently been accepted for publication in the Research for All journal. It will be published in the November edition. We did this research, or this evaluation, with researchers across Africa and the globe. So if you look further, we see that a lot of work has been done to produce research, but this population is left out. If you look at the graph to your left or to your right, it shows compliance to accessibility across all the resources following the Web Content Accessibility Guidelines. And if we take an example like alternate text, we see that it's as low as 20%. This means that someone who is blind can get access into the website, but will not be able to see or read the resources. And if you look at something like color, for example, it's totally blank. This means that someone who has like color blindness will not be able to consume anything on the website, even if they have accessed the database. So these are some of the challenges we're looking at because there has been a lot of talk about disability working groups, but the resources seem not to be accessible. In essence, accessibility has to be all or nothing. So how do we do it differently? We worked with the families and with the families building from the global agenda of nothing without us, nothing for us without us. So we started with conversations with people with disability, asking them questions like, what are your challenges? What are your experiences? What would you want to see to say that this works, this intervention works? How you want it brought to you? And how do you want it delivered? like that. We did this with them through through focus group discussions and stakeholder meetings with them. And we went further to synthesize the evidence. We appraised the recommendations. We reviewed the recommendations. We reviewed all of this with people with disability, the community health workers, and the Ministry of Health. And at the end of the day, we had this toolkit developed for disability that brings the research into the household. So in essence, this toolkit gathers research that has been synthesized in very digestible formats for people with disabilities, such that community health workers carry these tools and do household visits into the households of people with disability and give them these recommendations. So here, bringing in voice for people with disability, inclusion and equity. This graph here just show how the voices of people with disability were brought into the design of the intervention and through the process of the intervention. We used Max QDA to do this, to carry out this process. And in our intervention, we had some interesting results through education, health, social well-being, livelihood, and empowerment. This has also been developed into a paper titled Using an Innovative Family-Centered Evidence Toolkit to Improve the Livelihood of People with Disability in Bamenda, Cameroon, a mixed method study. This has also passed the first review in Frontiers, and we are currently working with the second reviewer, and the hope is that it will publish before the end of the year. So we see that we have quite some improvement in empowerment. This is because we incentivize the process. What do I mean? This means that when the community health workers bring the research into the households, they set a target for the family. And when you reach a certain score of 65 points and above, you are rewarded a seed fund to start off an income-generating activity of your choice that will support the unmet needs of the child with disability. For livelihood, we don't have so much of improvement there. This is because the seed fund was also small. The seed fund we're giving the families of children with disability is about $186. So livelihood there, we have just a little. And we see social well-being. Social well-being is quite an improvement. Social well-being is relative. For example, I would say that when I was growing up, I would wake up in the morning and walk like 2 kilometers to fetch water before I come and bathe and go to school. And when I return, I have to go fetch wood before I come. But in today's age, I wouldn't want my daughter to do that. It will look like, so it's relative. That's why we have those results like that. So valuing evidence in EIDM differently. This is how we had incentivized the process. The peak on the left shows the evidence indicators, how the families complied and got scores. So those are scores. At the end of the day, we are going to tally them and reward them with a seed fund of 186. So Ankini's family followed this approach with us, and we also encourage what we call the Njangi approach. This is an African approach where proceeds from your business are saved so that they can be reinvested, and through this business model, other people or other families of people with disability can be brought in to the process. And we also follow a model which we call the Joseph's coat of many colors phenomenon. This means that the proceeds of the income generating activity are not focused only on the child with disability, but we have this model where we advise families on how to spend the income gotten from the businesses. For example, some go for saving, some go for acquiring insurance premium, some go for supporting family family needs. Some go for for buying a gift for the child with disability and their siblings, so that all the attention will not be focused on the child with disability. And at the end of the day, what happened to Joseph in the Bible will not happen to the child with disability. We all know about the story of Joseph, right? So, valuing evidence in EIDM differently, including Ankini's family in the design of this intervention, enables inclusion, it promotes equity, and it builds trust. These are populations that are likely to be left behind the evidence train. We are likely to do things for them and not with them. So, including existing structures like community health workers and social workers as well, increased trust. These are people that work with them on a daily basis. They do home visits. And it also facilitates government ownership and systematization. And it ensures sustainability, because the community health workers will continue working even if our own intervention ends, which we don't hope that it ends. So we move to perspective. I had an opportunity to do a cultural exchange in Holland, where I met a couple of people, and we did some exchanges, built more partnerships, and we're looking forward to doing more cultural exchanges. And one of the things that our project or our intervention promotes or encouraging is building a my own identity, giving the person with disability a my own identity. This is through the disability card. The disability card is like an identity card for the children with disability who otherwise did not have a disability card, did not have birth certificates, and were left behind and were excluded from basic services, because if you don't have a birth certificate in Cameroon, if you don't have an ID card, you cannot access basic services. So one of the key things we're working on is having people with disability acquire disability card so that they have their my own identity. And also, during one of our discussions with the families with disability, one of them said they just want to live the good life. So working on the good life, solidarity fund, and business model. Here is a business plan developed by one of the families of the children with disability. When they got when they scored 65 points, of course, so you prepare a business plan and we evaluate it and we fund your business. And this here is a call to action for all editors to insist on accessibility check for all articles. And it's also an opportunity for us to lead. So you have to check that when you do your publication, before it gets there, you have done all accessibility check.
Maybe one more minute.
And a bigger trial to assert and facilitate intervention. By way of conclusion, I'd like to encourage everyone in the room here that it is in our hands to build the Africa we want that leaves no one behind the evidence-informed decision-making train, including people with disability. Our approach brokers evidence to help people with disability live a more decent life with better access to basic services, a sense of belonging, entitlement, decent life, and fulfilling work. Thank you very much, and I share cola notes with you.
Thank you, Nain. I think the Njanji and the Joseph, the coat of many colors, caught my attention, and I'm glad you explained how that came about. So thank you so much. So we've had 3 really very different cases looking at how we can value evidence differently, looking at equity, inclusion, and trust. And so now I want to open up for questions. Do we have any questions, comments? I'm hoping that you are taking down any questions that you may have. And I want to start with maybe 2 or 3 here and then online to ask Charity if you have any questions online. Do we have somebody who can help us with the mic? There's a hand right in front here.
Thank you, colleagues. Thank you, presenters, for this insightful presentation that you've just made. Mine is an observation, and I also have a question embedded in that observation. Yes, we can talk of equality, inclusion, trust, and not practicing it. We can develop tools. This will not work. It will actually work in vain. What am I saying? Yes, we might be valuing the equality, inclusion, the trust, but in theory, but are we practicing it? We can come up with a panacea of interventions that are meaningless. As champions of evaluations or voice of the voiceless, we will not be able to achieve SDG 10 that talks of reduced inequalities, because it's actually the mantra says, leave no one and leave no one behind. And we also won't be able to achieve our Agenda 2063. As we go back home, as champions of evaluation, let's advocate for the inclusion of the PWD, people with disability, at such conferences. What am I saying? Yes, we are here. We are talking on their behalf. Where are they? Are they here? No. We are talking on their behalf. I think they can also speak. So let's include them here. I think you actually said something that touched my heart, because my heart bleeds when you talk of things to do with PWD. What we have actually done is we have invited them to dinner, but we have not invited them to the table. So this is the table that we should invite them to, so that they also take active participation in this. I submit. Thank you. Sorry, I forgot to introduce myself. I am Caroline Makuvire, Director Evaluation and Learning with the Office of the President and Cabinet, Zimbabwe. Thank you.
Thanks, Caroline. That's a great challenge, and I'll let comments later, but any other questions from the room? Comments, questions? Thanks, JP.
Thank you so much. I do appreciate what colleagues are sharing. It's insightful, and as in some context of the context that they say, aluta continua. This is the beginning, not the end. There might be gaps, and I think together we'll keep filling them. The question on evidence transformation index, looking at the criteria, we have got Black people. What about a country like mine, where we are all Black? Just try to put that in the context where in some other countries, they might have only Black people. Language use or language simplification. I like this. And the challenge to all of us here is, when you are talking about scientific evidence, what do we mean? We are talking about the p-values, confidence levels. How are we going to translate that into my mother tongue's language? The one she can identify with and understand where there is change or no change. That's a challenge to us again. And lastly, I do really appreciate the Njangi approach. I wish even all these tools, we are sitting with the Ankini family to co-create the tools, to co-create index. Can we do it? And I think, yes, we can. Thank you.
Thank you for that. We've got another question on the right, in the middle there.
Thank you to the panelists. I actually have a question for you, Andile. I mean, recently I was working on a systematic review about gender equality and women's empowerment. And what I noted is sometimes the discrepancy between what the research claim they will do as an approach and what they actually end up doing. And a typical example that I have that frustrated me a lot when I was doing the screening is studies that say we are taking a gender sensitive approach and the only thing we see is actually have disaggregated one or two outcomes between men and women. And when you look at the actual methodology of the research, they conduct the interview on women's empowerment and gender equality in a fragile context by interviewing the wife and the husband at the same time in the same room and asking the wife, are you victim of any intimate partner violence? So that's the kind of frustration that I encounter sometimes. And I mean, I'm not a specialist at all about all the topics that we talked about today on disability, but I assume this is maybe a challenge that we encounter sometimes in research. So I wanted to hear a bit about, as you worked on this project, what was your perspective on this between what is claimed by the research as the approach and what is actually being done? Is it an issue in the methodology developed? Is it kind of a buzzword now to say we're inclusive and we take this into account? Or is there anything we can do to avoid this kind of issues? But thank you all.
Thank you so much. So over to you, panelists. If you can take just a minute each to give your response, and then we'll take another round of questions, hopefully from online. Our time is almost up, but we'll indulge ourselves another 5 minutes.
Okay, thank you so much for the questions. I think I will start with your question around Black people. So I think also just to reiterate that this is based on a framework that was developed to sort of address past injustices. So for the South African context, Black people were excluded from participating in the economy of the country. So hence, any transformation framework or transformation tool, therefore, is usually aimed at Black people. But if it's only Black people in your country, then how do you define transformation in that context, right? So what are some of the tools that you have? What are some of the frameworks that you follow as far as trying to balance things out, sort of balance the equilibrium or have that sort of balance between the different types of populations that exist. So I think to answer just that question. And then ATN, I think, so that remains an issue, I think, in the evidence world. I think we took time, so I worked on a project where we were looking at birth registration in Mozambique, Nigeria, and Cote d'Ivoire. And we did the very same exercise of trying to find the extent to which the evidence is sensitive to gender and equity. And that is one of the issues that we came across, right? So at first glance, because sometimes we would then, when we come across a study, the first thing you do is to search for keywords, right? So you search for a keyword and you say equity, and it comes up and you're like, yes, finally, someone actually did it. But when you actually take the time to try and read the study, you realize, okay, they had great ambitions, or maybe they used the word there on the abstract to look very nice. But when you assess the study and you read further, you realize that, no, actually they did not maintain what they had planned out to do. So I think those are some of the issues that we come across, and I think it's probably a call to researchers that are doing the actual sort of research work of collecting data and analyzing data and to say, if you have those great ambitions of being quite sensitive to equity and inclusion, maintain that as well as you analyze, as you actually go on the ground and report on these things, so that it's sort of not a thing where you throw so that you look nice, you throw it there on the abstract so that I'm like, oh, nice. But then when I read the paper, I'm like, oh no, right? So I think it's a challenge. I don't think we have figured out a way around some of these issues. It's a work in progress. Unfortunately, in 2023, some of these things are still a work in progress, which is quite disappointing. Over to you, Evelyn.
Thank you very much. I just want to speak to the question of translating evidence and the language that we use. Quite obviously, I think we all are in agreement that sometimes how we package research as academicians and also as practitioners excludes other populations, whether it is communities that we work in or it is policymakers. So in our case, in education, where we were specifically focusing on supporting policy, we feel very strongly that we not only just need to simplify the language, but also use the language that makes sense to policymakers. And that's really part of what we are considering as an appraisal criteria for grey literature as well. And so it's such an important and very big issue when it comes to actually translating research into practice or into policy. So yes, I agree with you that language is very critical.
Great. Nain, I can ask you to just focus on the question that Caroline or her reactions that she gave on people living with disability.
Oh, I think she gave a very nice comment on the invite. We are in the dinner, but the people with disability are not here. So I just want to say that the Evidence 2023 made available the opportunity for everyone to be at the dinner. Sometimes it's challenging to get everyone at the dinner table, like this conference. So you can only as much as bring the invitation, make it accessible, but if someone is not willing to be at the dinner, we can't force them to be on the table.
Thanks for that. Charity, do you have any questions from online audience? From yesterday? Okay, come over. Let's hear the questions.
Afternoon, everyone. Hello, everyone. That's better. So we had some questions and comments for Adeline for your presentation yesterday. So Nkululeko said, amazing presentation. He loved the valuing of evidence differently, which is actually what you're talking about today. And he said the decoloniality of evidence sounds much like doing engine repairs on a car that is well in motion. Are there any ways to make it easier on everyone in the ecosystem? Then he said, my concern is that if you embrace the change, you may get locked out because of the status quo and all the barriers. Should I read all of them? 3, okay. Then there was another question from Ian Hopwood. He said, can we think of ways that traditional knowledge systems are changing and adapting to face new challenges in African societies that are changing so rapidly? Then the last one that I'll pick is from Carol Mukira. So she said, interesting thoughts there on decoloniality of evidence, the need to recognize the diversity of indigenous knowledge systems, values, and cultures as we look at the entire knowledge production and evidence synthesis process. Or it was more of a comment. Yeah, thank you.
Thanks for that. And I also open for you to answer some of these questions since you're also tackling the same topic. I think the idea about decoloniality of evidence, like fixing a car that is in motion and something like you may be closed out, it's because we don't know who we are, we're not sure about ourselves. We are also need to start changing our own mindsets, because it's almost like, okay, if I take this stance, maybe the funders will not give me money, And we actually experienced that when I was a FRIA president, that you talk about certain subject matters, people are not going to give you money, but you need to know why you're doing it. And that this is a long game. It's not a short-term thing. It's a long game. And now everybody's talking about the things that we were talking about from 2007. Yeah? So we started the discussions in 2007, started by the late Suli Gariba and also Professor Zenda of here. But now everybody's talking about decolonizing evaluation, decolonizing evidence, and somebody spoke at a conference I was at. They said it's not really, you can't undo what was done. You actually need to transform the whole ecosystem. Yeah? We need to transform the whole ecosystem. So we might want to stop the car and really maybe change the engine so that we can get to where we want. That's my response. And I think I'll just comment on Ian's thinking around are there ways that the local knowledges are transforming as we move around with all the changes? Oh, definitely there has been impact through globalization, and some of the traditions are being transformed. But sometimes it's in a not such a good way because we forget our old ways of doing things. But we know that the world is changing, and it's important to realize that we cannot be living in isolation, but we need to ensure that we don't forget where we came from. I think yesterday I spoke about history, that history is so important, where we came from, because the things that worked. I'm just talking about, when we look at climate change and the way the African people were living in harmony with the environment. What happened to all that? Why are we not doing that right now? It's because we've got so many ideas coming in telling us this is the way you should do things, and then we just throw away our old ways of doing things. And any other comments or questions that have been sparked by the questions? Okay, if none, I'll give you just one last closing sort of remark. So what? After all this, what are we going to do? Why is it important? What are your closing remarks? Just short and to the point, please.
Okay, I was just checking the mic. So I think it continues to be quite important for us to assess the extent to which the evidence that we use to inform policies and interventions is sensitive to gender and equity. So one of the points that were made is that these people are not here. So I think one bridging gap, it's not the ultimate answer, but sort of one way we can bridge that is that we make sure that the evidence that we use has those people represented. So I feel like it continues to be quite important that we continue to advocate for the importance of gender-informed policies as well, equity-informed policies, not just evidence. So when we constantly talk about evidence, can we be also aware the extent to which this evidence is gender-sensitive, equity-sensitive, and the element of trust as well? Thank you.
I think that as evidence community, it's very important for us to understand that our work would be meaningless if we don't understand the needs that exist within the areas that we work in. We may have very interesting topics that we want to study and we want to research on or we want to synthesize, but unless we sit around the table and co-create and really design and understand the problem together with the policymakers or the communities that we work in, our work will remain to be just a very nice thing to see and read, but doesn't really have an impact. So for us to have an impact, we really must agree together with the people that we work with what the problem is, so that when we come up with a solution, it is also accepted.
Okay, I'd like to encourage everyone here today, all of us researchers, practitioners, whatever capacity we are in. At every one point, we have to understand that the essence of generating, synthesizing, or whatever we're doing, the evidence is for it to impact lives, is for it to be used. So when we are generating, synthesizing, or practicing, we should all endeavor to ask ourselves, how will this impact the life of a person with disability? How can I include a person with disability on board? What are the challenges? How do I overcome it so that they are not left behind the evidence-based practice stream? And that way, we are moving towards the 2030 and 2063 agenda. Thank you.
So thank you so much, everyone. Sorry we ran about 10 minutes late. And I think the next session is at 3:15. It says day 2 photo shoot. So just look at your agenda, and it's supposed to take place in plenary, is it? Okay. All right, thank you.